Hi, welcome to the crash course on the pharmacology of penicillins. Penicillins are a large group of antibiotics that kill a wide variety of gram-positive and some gram-negative bacteria. They bind to specific proteins called penicillin binding proteins and inhibit peptidoglycan, which interferes with the normal cell wall synthesis. This causes the formation of defective cell walls that are unstable and easily broken down, which then leads to bacterial death. Side effects include GI issues such as nausea, vomiting, and diarrhea, and neurological issues such as headache, dizziness, and seizures. Less common side effects include fever, blood disorders, kidney problems, and C. diff, a superinfection caused by the overuse of antibiotics. One of the most common adverse reactions of penicillin is an allergic reaction, which can involve symptoms of hives, shortness of breath, rash, and swelling of the face, lips, tongue, or throat. Less commonly, anaphylaxis can occur, which is a life-threatening allergic reaction. It is important to teach our patients to keep this medication in a closed container, away from heat, light, and moisture, and ensure to take any biotic for the full course of therapy, even if they feel better. Take penicillin at regularly scheduled times and even-spaced intervals. Contact your provider immediately if you experience any symptoms of an allergic reaction, or if your condition persists or worsens. Avoid taking penicillins with caffeine-containing beverages, as well as fruit juice, cola, citrus, and tomato juice, as it can decrease its effectiveness. Probiotics can be consumed alongside penicillin to prevent C. diff. Notify your provider before use if you are on any blood thinners, as this medication can cause bleeding. In addition to educating the patient, we must also educate the patient's family members to keep penicillin out of reach of children and be cautious of the signs and symptoms of an allergic reaction, as well as assist their loved ones in taking penicillin at scheduled times as structured by prescribing provider. Oral penicillins are to be given with at least 6 ounces of water and with food 1 hour before or 2 hours after meals to maximize absorption. As a nurse, you should use proper diluent when administering IV penicillin, and be sure to infuse over the correct amount of time. Assess for drug allergies prior to administration, and be sure to know the trade name of all antibiotics, because some penicillins do not have the same suffix, such as zosyn and augmentin. In case of life-threatening emergency like anaphylaxis, have emergency medication and equipment at the bedside. That concludes our crash course on pharmacology of penicillins. Thanks for watching.
Created using Powtoon.